Good morning, everyone. My name is Eric Tseng. I'm a benign hematologist from St. Michael's Hospital in Toronto. Thank you for taking the time in this crazy time to actually do the examination today. It's going to be a worthwhile time, I'm sure. I'm one of the co-leads for the exam this year.
Hi everyone, my name is Habib. I'm a hematologist oncologist from Montreal. I am the other co-lead on the National OSCE exam.
So as I was saying, we really acknowledge that this has been a challenging time this year with COVID-19. We would usually do this in person, but this year we'll be doing it virtually or in person at each of your own sites. The purpose of this is solely for your learning purposes. And so this is to benefit you. So please relax and just do the best that you can. We recognize that you're all at different stages in your training and at different parts of your preparation for your exam if you've started. And that's okay. You can just take this as a check-in point to see where you're at.
So usually the exam is designed to help you prepare for the Royal College oral exam component. But as you know, there is no oral exam component this year. We still feel this exam will be really helpful for you because the content is clinically relevant. And for those who are current PGY5s, you will likely have an oral exam in 2021. So hopefully that will be helpful in your preparation going forward too. Usually the format of the Royal College OSCE is 60 minutes of preparation time to run through stems for 10 cases or 10 stations, and 10 minutes are given to go through each of those stations. Usually 2 stations are run through at once with one examiner in a 20-minute block. This practice oral exam will have 45 minutes of preparation time for 8 stations instead of 10. And you will have 10 minutes for each station. This may or may not be run through as 2 stations at once in one sitting, depending on how your school decides to deliver the exam. So with that, each school is going to decide whether or not they want to deliver the exam virtually or in person. So some of those logistical details surrounding that will be discussed by your program directors at your given sites. And this would include how to transition between each station.
So a little bit more about these stations themselves. You will notice that before the exam, you have been provided with a package of stems. So there's 8 stems in your package. And as Laura mentioned, you have 45 minutes to go through all of them and prepare them in advance of actually going into the OSCE. So that's the unique part of the hematology exam, is you prepare beforehand, unlike the internal medicine exam. Each station, as Laura mentioned, is 10 minutes long. And then 7 to 8 minutes in, your examiner will actually ask you a follow-up question that adds an additional detail about your patient's clinical course. It could be progress on what happens when the patient receives a certain medication, new lab results, things like that. The other thing to note for those of you in Quebec, we have provided French language stems as well, but the follow-up questions have not been necessarily translated into French, but the initial stem is actually written in French.
Okay, so some tips for you going forward. Focus on the actual question that is being given to you. This is a focused hematology exam, so unlike the general internal medicine oral exam you would have just gone through, you are really meant to fulfill the role of a consultant, and so you're meant to be specific. Don't forget to ask relevant history and physical exam related questions as needed. And if you are providing treatment, again, remember to counsel on side effects as any consultant would.
So that's the nitty-gritty of the exam. We really hope that you will learn something from this and take something from the experience, even though it's virtual this year. We have to say a few thank yous just to those who helped put the exam together. So firstly, we had many exam writers and editors contribute to the content this year. This includes Doctors Chris Patriquin, Gloria Lim, Caroline Elbaz, Anna Nikonova, Michael Crump, Hassan Sebai, Lee Mosesen, and Rosemary Tremblay-Lemay. Laura and myself also wrote some of the stations as well. For translation, we were lucky to have Doctors Melissa Boileau, Caroline Elbaz, and Catherine Grolot also help with the translation. Luckily, I was not the one translating, as you can tell. And we really want to thank the program directors and the administrators from each program this year for taking the initiative to actually facilitate the exams. As you know, this is typically centrally done from the University of Toronto, and your programs this year have really taken it upon themselves to try to put this together for you. And finally, and I think most importantly, we want to thank two people. One is Dr. Tina Trenkhaus, who has been one of the key organizers for the National Hematology Retreat every year. But finally, Nina Chana from the University of Toronto, who really is the lifeblood of the National Hematology Retreat and the OSCE every year. So with that, take care, and we really hope that you enjoy the exam this year. Take care.
Thank you, everyone. We appreciate your feedback at the end.